Hello. This skill is called Providing Perineal Care to a Female Resident who is incontinent of urine. According to Prometrics, you are to perform this skill within 17 to 19 minutes. This skill is one of your longest skills to perform. It is performed with the mannequin. The supplies you will need will be 4 chuck pads, 1 at the sink, 1 at the bedside, and 2 for the bed. A pair of gloves, a towel, 2 washcloths, soap, and basin. Okay, so the first thing you want to do is you want to knock on the door.
Come in.
Wait until a patient states come in. Hello, my name is Janice. I am your certified nursing assistant today. What is your name?
Miss Jones.
Is it okay for me to call you Miss Jones?
Yes.
Okay, Miss Jones, I'm here to remove the salt pad from underneath you. Is that okay?
Yes.
Okay. The first thing I want to do is give you your call light so that I will be able to go and wash my hands and gather my supplies for you, okay?
Yes.
I will return. So you go to the sink, you do a 20-second hand washing with your hands under friction lather for 20 seconds of the hand wash. Okay, after that, you gather your supplies. You always want to lay down your barrier or your chucks first. So remember, one at the sink, one onto the bedside table,
Come in.
and 2 for the bed. So I'm gathering up my supplies, Mrs. Jones. Okay, I will be back.
Okay.
I always encourage my students to place as many gloves as you can inside your pocket. Enter back into the room, knock knock.
Come in.
Okay. You're going to lay your towel, your washcloth on one side, your rinse cloth on the other. Inform Ms. Jones you'll be back. Ms. Jones, I will return.
Okay.
You're gonna go get water. enter back into the patient's room.
Come in.
Okay, Ms. Jones, are you ready for the procedure?
Yes, I am.
Okay. First thing I'm going to do is take away your call light. I'm going to close your privacy curtain. And then I'm going to let up your bed. Remember, waist up with the bed to your waist. The next thing you would like to do is for the client to test the water. Miss Jones, will you please test the water?
It's okay.
Okay, good. Okay, the next thing you want to do is remove your salt pad. So to do that, basically what you want to do is have the resident come to you a little bit so that you can turn her to her side. Okay, Ms. Jones?
Yes, it's okay.
Okay. Okay, 1, 2, 3. Over. And her legs. 1, 2, 3. Over. Always crossing the feet. So now, Ms. Jones, we're going to turn to the side, okay?
It's okay.
Okay. You turn Ms. Jones to the side, making sure she has her pillow, and then you remove your saw pad. This is when you are going to place a pad for cleansing the area. Okay, Miss Jones, at the count of 3, you ready to come back?
Yes.
1, 2, 3. Okay. Never reach over the patient. You have to go around the bed. Body alignment. So Ms. Jones is going to actually bring you a little bit to me, okay? 1,
Okay.
2, 3. 1, 2, 3. Uncross her legs. 1, 2, 3. Okay, Miss Jones, I'm going to ask you to turn over to your side so that I can remove the salt pad completely, okay?
Okay.
1, 2, 3. Immediately place the salt pad inside the garbage can, whereas now you will be able to place the cleaning pad down. Okay. You do not have anything to do with the patient at the top of her, but your concern is at the bottom near the perineal area. So therefore, the bottom can be rolled upward. in performing this test. You expose the patient's perineal area okay. Bring your table as close as you can. You can place your towel at the patient's knees. And this is where you're going to begin your cleaning technique. Your washcloth. Soap. You want to begin with your thighs. So it's wash, rotate the washcloth, wash. You can rotate your washcloth again. Wash, rotate, wash. Put the washcloth down. Pick up your rinse cloth. Rinse, rotate, rinse. You can use the washcloth again with rinse and then another rotation, rinse. Put your rinse cloth down. Now you will be able to pat dry the areas. Of the thighs. Now you're going to begin to clean the vaginal area. Starting with your wash. You want to start with the side furthest from you first. So from top to bottom, infection control. Top, wash, rotate, wash. Okay, you can place it back into the water. Wash. The other side, rotate, wash. Place it into the water. Proceed in the middle. Wash, rotate, wash. You put your washcloth down, and now you begin to do it again with your rinse. Starting from the side furthest from you, rinse, rotate, rinse. In the water, rinse, rotate, rinse. In the water, in the middle now, rinse, rotate, rinse. Place the rinse cloth down, pat dry, pat dry the sides furthest from you, pat dry the side closest to you, and then pat dry the middle. So now you have completed washing the vaginal area. So what you would want to do now is instruct your patient to test the water. Mrs. Jones, will you please test the water? Is it still warm enough?
Yes, it's warm enough.
Okay. This is when you're going to proceed to wash the backs of the patient. So again, check your body alignment. If she's aligned whereas you can turn, you go ahead and do so. Okay, Ms. Jones, I'm going to turn you to your side, okay?
Okay.
Okay, count of 3. 1, 2, 3. You're going to expose the back side of the patient. And this, again, you can lay your towel down. You're going to take your wash, apply soap. Again, the side furthest from you will be this side. So infection control, so you're going to wash from bottom to top. Infection control. So you're going to wash, rotate, wash, place it in the water. Apply your soap, wash, and I call these cheeks. Wash the other cheek, rotate, wash. Apply your soap, and then you're just going to wash in the middle. Wash with rotation of your washcloth, wash. That was wash. Now you're going to pursue and do the rinse. Rinse, rotate the washcloth, rinse. Again, rinse, rotate your washcloth, rinse. In the middle, rinse, rotate your washcloth, rinse. Place it down. You're going to now pat dry all areas. While you are in this position, you're going to remove your cleansing pad. And now you're taking your 4th chuck. Remember, it's 4 chucks you will need for incontinent care, and place down the 4th chuck. And this chuck will stay because we know that our patient may be incontinent again. Okay, Miss Jones, you want to come back to me? Sure.
Yes.
Okay. Slowly. You go around the bed. You can actually have the patient lift their leg. Miss Jones, can you lift your leg?
Okay.
And you can turn her slightly. Take away the cleansing pad, put it inside the garbage. Take the pad that you're going to leave in place, keep it in place. Okay. How was that, Miss Jones?
It was good.
Okay. All the time that you're doing your care, you are talking as much as you can to the patient, asking them, how was your day? Did you have lunch yet? Or breakfast? Just engage in conversation. Okay. Make sure that your linen is suitable. For the bed, this is when you're going to now offer your call light. Miss Jones, I need to take care of the water and clean up, okay?
Okay.
Here is your call light. I will return.
Okay.
Okay. You can open up your curtain. That's opened. You can let your bed down. Okay, you can take your linen and place it in the linen basket, which is going to be right in front of your task. You're going to put the remaining material inside a drawer. This is when you're going to travel with your basin to the sink. Miss Jones, I will return.
Okay.
I always encourage students to place the basin down onto this chuck so they will be able to think what's next. You pull down a paper towel, you turn on the faucet. You're going to take down 3 paper towels to dry your basin. One wet, one dry to clean your table. This water, where does it go? It goes inside the commode for infection control matters. Pour it inside the commode and you rinse it 3 times. Fluid inside the commode. Bodily fluids, as we call it. 2, 3. You set your basin down. think, do I need the water anymore? And turn your water off with the paper towel. You can proceed by drying your basin. 1, 2, 3. For the state of New York, Prometrics wants you to do everything in 3. So it's 3 paper towels I use to dry my basin. There, now you can take away all material that you use for this task and place it inside the garbage. You travel now to your table with your wet and dry.
Okay.
You're traveling with your basin back into Miss Jones' room. You're knocking on the door.
Come in.
Okay. Okay, Miss Jones, I'm back. Placing your basin inside her bedside stand. You're taking away the chalk on the table. And you're giving her bedside table a cleanse and a dry. You're taking off your glove, throwing away the paper towel, placing her bedside stand towards her, asking Miss Jones, is there anything else that you'd like for me to do?
No.
Okay, I will return. Step out of the room. This is when you're going to do another hand wash for 20 seconds with friction. Come back in front of your task. Look around your room. The patient has their call light. Curtains are open. Miss Jones looks comfortable. And then you can stand in front of your task and put your hands up and state, I washed my hands for 20 seconds. My task is complete.